Today, we're diving into a condition that affects millions of people, overactive bladder, or OAB. Now, it all starts with a feeling that, let's be honest, we all know, that sudden, urgent need to go. But what if that feeling is just the tip of the iceberg? We're about to see how one single symptom can point to a whole bunch of different causes, and why figuring out the right one changes everything. So here's our game plan. First, we'll nail down what overactive bladder actually is. Then we're going to play detective and look at a really cool diagnostic tool called the urodynamics test. We'll follow 3 real patient cases, and each one has a surprising twist before we wrap it all up and see why getting the right diagnosis is the most important step of all.
All right, so let's start with a big question. What exactly is overactive bladder?
You know that feeling, right? That sudden, overwhelming, I gotta find a bathroom like yesterday feeling. It can totally derail your day, whether you're in the car or in the middle of a big presentation. Well, that feeling, that is the absolute core of OAB. In the medical world, this has a name, urgency. And the official definition is just spot on, a sudden, compelling desire to urinate which is difficult to defer. It's not just a little nudge, it's a demand. And honestly, this single sensation is the key to the whole OAB puzzle. But here's the thing, urgency almost never shows up to the party alone. OAB is actually a syndrome, which means it's a whole collection of symptoms that hang out together. So along with that trademark urgency, you've often got increased frequency, nocturia, which is waking up at night to go, and for a lot of people, urgency incontinence, which is when you leak a little when that sudden urge hits. So the main thing to get here is that OAB isn't a disease itself, it's a specific pattern of symptoms. So if OAB is just a collection of symptoms, how do doctors figure out what's really causing the problem? Well, that's where you have to look a little deeper, using a special test called urodynamics. And this right here perfectly sums up the mystery. On the surface, what the patient feels is pretty straightforward: urgency, frequency, maybe some leakage. But what's going on underneath could be anything from an overactive muscle to a hypersensitive signaling system to an actual physical blockage. See the problem? The symptoms look the same, but the treatment has to be aimed at the real cause. This is where the urodynamics test, or UDS, comes into play. It spits out these charts that, to you and me, just look like a bunch of squiggly lines. But to a urologist, these lines tell the whole detailed story of what the bladder is doing. Second by second, they reveal the hidden culprit behind the symptoms. So let's see how it works with our first case. Okay, case number 1. This is a 64-year-old woman, and her OAB symptoms have pretty much taken over her life. Just listen to her own words. You can just feel the frustration, can't you? Simple things that we take for granted, like having a cup of coffee or traveling, they've become huge hurdles. She's going through 5 or 6 pads a day and waking up 4 or 5 times every single night. Her symptoms are just relentless. And here it is. This is her UDS chart. You see those sharp spikes in the green line? That's the bladder muscle. It's called the detrusor, and it's squeezing all by itself, without her permission. These unwanted contractions are the smoking gun. So the diagnosis isn't just OAB, it's super specific: detrusor overactivity. The muscle itself is the problem here. Now let's switch gears completely for our second case. This is a 35-year-old woman, and her symptoms are a little more confusing. For her, the problem isn't the muscle, it's the message. Her story is all about confusion. She's got this worsening urinary frequency going every 30 minutes in the morning, but she's not even sure if or when she's leaking. She just has this constant, nagging feeling that she has to go. And check out her UDS chart. So unlike our first case, that green line is pretty flat, right? No big dramatic spikes. The real clue is in the numbers. She reported a strong desire to go when her bladder only had 71 cubic centimeters of fluid in it. Now, to put that in perspective, a typical bladder can comfortably hold 300 to 400. So her muscle is fine, but her nerve signals are screaming, go, way too early. The diagnosis here? Bladder hypersensitivity. All right, our final case involves a 53-year-old woman. And this one adds a whole new layer of complexity. The key detail is that her OAB symptoms started right after she had surgery for something else. This quote is a massive clue. Before her surgery, her issue was stress incontinence, leaking when you cough or sneeze. After the surgery, that was fixed, but it was replaced by this severe urgency and a really weak stream. Clearly, something changed during that operation. So her UDS test tells the first part of the story. You can see when she's trying to go, her bladder pressure, that green line again, is way higher than normal. It's off the charts. This means her bladder muscle is straining. It's pushing way harder than it should have to. So this chart tells us what's happening. The bladder is working overtime, but it doesn't tell us why. And here is the why. This image, which was taken at the exact same time, reveals everything. You can literally see a physical narrowing in her urethra. It's an obstruction, and it was likely caused by the sling that was put in during her surgery. Her bladder was straining because it was pushing against a roadblock. So the final diagnosis is bladder outlet obstruction. That sling, which was supposed to help her, had accidentally created a kink in the hose, so to speak, and her bladder was reacting to this blockage by becoming irritable and overactive. Without this deeper look, she probably would have just been given medication for an overactive muscle, which she didn't even have. Okay, so let's bring all three of these cases together. What do they really teach us about why it's so important to look past those surface-level symptoms? I mean, this table just says it all, doesn't it? We have three different women, all showing up with those classic OAB symptoms of urgency and frequency. But the UDS test uncovered three totally different root causes: an overactive muscle, faulty nerve signals, and a physical blockage. And you can bet that treating each of these requires a completely different plan. And that really brings us to the number one takeaway here. You simply cannot get to the right treatment without an accurate diagnosis first. It's not just some academic exercise, it's the absolute foundation for actually getting better. It's what separates just guessing from truly treating. And that kind of leaves us with one final thought. In medicine, and maybe in life, the symptoms we see on the surface are so often just hiding a much more complex story underneath. The story of overactive bladder is a powerful reminder that sometimes, to find the real answer, you just have to be willing to look a little bit deeper. Thanks for digging into this with us.